Hello, all of you beautiful humans. So happy to be joining all of you fantastic peeps on this live recording for episode 14 of Inspiring Insights, which is the Vagina Dialogue. But I'm your host, Erin. I'm in the business of amplification. And what I mean by that is that I looked inside myself and asked the question, what makes me feel alive? And of course, that was earlier this year. I've asked myself the question tons of times before, and I've done things appropriate to what I get answers in. And I think this year is no exception. And, you know, the answer was really born through the development of this show called Inspiring Insights, which is brought to you by Reawaken Co., which is the company that I helped form earlier this year. And that company really helps people waltz through the natural wellness world in good company. So that's right. I really love hearing and sharing the passions of practitioners and how they're doing the most incredible things to guide women and non-binary folks to a better version of their own life, a better version of their own health. And I'm so glad that Reawaken can be a part of that. So what we do is we are an online education platform, and we focus on connecting you to the right network of natural wellness practitioners so that we don't get lost in the system that is already broken. And we're trying to reframe that and build up a new framework for wellness. So go ahead and follow us on social media. We're at reawaken_co. That's just CO. And this is our show, Inspiring Insights, where we host amazing practitioners like Dr. Alisa Murli in our network to inspire a more conscious world, helping you run just as authentically as you do efficiently. And I know a lot of folks these days are very, very efficient. So if you are tuning in live today, drop a little comment in the comments section below. I love everyone that pops in and says hello and stays for the chats. And if you are watching the replay of this, I feel you. We feel you. We feel your energies. And thank you for showing up today for yourself. And today we're bringing a very special guest into the spotlight. So this is Dr. Alisa Murli, naturopathic doctor. Welcome, Dr. Alisa.
Thank you, Erin.
Of course. and your philosophy is really to promote a well-balanced and therefore sustainable, healthy lifestyle for your patients, right? So we're going to get into that more, obviously, specifically in the pelvic health region, more specifically for folks who have vaginas. And so Dr. Alisa Murli actually graduated from McMaster University. You have an Honours Bachelor of Science, and then she went on to complete her doctorate in Naturopathic Medicine from the Canadian College of Naturopathic Medicine. And so her main focus is in women's health concerns, particularly PCOS, endometriosis, PMS, PMDD, prenatal care, pregnancy, and postpartum care. You're also a pelvic floor therapist, and so that will help with concerns related to pelvic pain, urinary incontinence, and postpartum strengthening. So, Dr. Murli, you are also a birth doula.
Yes,
and you have extra training in cosmetic acupuncture as well, which is all of the things that all of my girlfriends might really, really enjoy. So you are just the one-stop shop, and I love that. And besides all that education, you're quite a social being. So in your spare time, you love spending some time with your dog, with your family, and with your friends, who I consider myself to be a part of that circle. And I'm so happy and honored to be there with you. So
thank you, Erin.
Yeah, thank you so much for being here. And I so appreciate you taking the time to teach our listeners and teach our learners what they have going on down there.
Thank you. Thank you so much for having me and for the wonderful introduction. Okay, so I just want to start off right off the bat with a poll, actually. So
nice.
Let's see.
So you got the hang
of
the
poll.
Did I do this? Yeah, perfect.
There.
Okay, so it's already published. Go for it.
So are you confident that you little grammar, sorry, that you will be able to accurately label a diagram of your female genitalia?
Ooh.
Yes, I mean, duh. Partially, you don't feel confident.
Okay, I'm gonna answer
There are
that.
no right answers, and it's totally anonymous. Okay. So partially.
Partially confident that you can accurately label the female genitalia.
Sounds good. Okay. So I'm just going to go ahead and share a graphic of a detailed external genitalia so we can go through that. There we go. Can you see that?
Yep.
Okay, wonderful. Okay, so here we have the wonderful external female genitalia. So correct me if I'm using any incorrect terminology, by the way. Okay, so at the top here, it's called the mons pubis. It's kind of just the top area for the anterior part, the front part of your, what you would call your vagina, that usually has just hair or not if you remove it. Right up here, it says prepuce of the clitoris. That means that there's just like a skin over top of the clitoris, because in this diagram, yeah, that's the skin of it. And then right there, glands of the clitoris. That means that that's just the actual clitoral tissue. You can see that they've colored it nicely so that you can differentiate. Your clitoris goes all the way down and round and up internally as well. You just can't see that part. This is your labia majora, which are the one of your vulva, so kind of like the outer vulva. Your labia minora is your inner vulva, and these all look totally different. This is just obviously a drawn picture of a vulva, so if yours doesn't look like this, then that's totally normal. Right here is your urethra. So that's really important when we're going to be talking about UTIs. So it's nice to see how close things are. So it's probably about an inch of space between your urethra and your vagina right here, and then which is also only a couple inches away from your anus. So all of this is super important right here. The vestibule, don't worry about that. It's kind of a non-existent, it's just a space really. This is your perineum right here, and that's just the tissue between your vagina and your anus, and that's typically what tears during childbirth. And that's about it. So,
but it doesn't always tear, right?
Doesn't always tear. No. But it can and often does, but doesn't always. And we can do things to help prevent that too. But we're not talking about that today.
Okay. And just so you have this diagram pulled up, I love that you started out with this because it's so, so important. And would you mind just saying a few words on, why it is important that folks actually get to know what their genitalia looks like, and like, should we get to know that? Like, what's the importance of that?
Yeah, for sure. So I feel every woman should know what their genitalia looks like and where everything is, because in order for you to know what's going on in your body, you need to know what it looks like and where it is. So just being in tune with your body, you are your best health advocate. So being in tune with where things are and what's going on can help you to better describe your symptoms to a doctor, for example, if something's going on. It's also important, we're not really getting into this today, but it's important for pleasure as well to know your genitalia.
Great.
So encourage everyone to, if you haven't already, if you haven't already, just go ahead and take a mirror, and on your own spare time, go ahead and look at your own genitalia and see if you can find the same things.
Nice. Okay. Yeah, I bet I'll do that later. But that was great, and I really appreciate the diagram. And it wasn't until I was maybe in university that I took anything seriously about my pelvic health in general. And I think it's really important and get to know it's really important just to get to know yourself for, like you said, sexual reasons, but also, maybe there's folks who are asexual, and that's okay too. And also for symptoms, like you said, of certain conditions that we're going to discuss. So that leads me, I think that's a really good segue into our next or my next question, which was, what are some common issues that my audience, which is around, 25 to 35, what are some, vaginal issues that those folks might face during that time frame of life?
So I would say most commonly in that age range, even if we spread it to be a little bit younger, from like age 18-ish to 35, would be like UTIs and yeast infections for sure. And even either chronic or just occasional. And also BV is, I'm not going to talk too much about BV. BV is bacterial vaginosis, by the way. But those are some of the really common ones that vaginal issues that you would experience.
Okay, so UTIs, urinary tract infections, yeast infections, bacterial vaginosis, and I'm assuming like other like sexually transmitted infections.
Yes, for sure. Yeah, we'll touch on a little bit, just but yeah, we're not really getting into those.
Yeah, and I think that's just valuable to mention as well, because folks who are sexually active tend to be around that age category.
Yes, exactly.
And I guess, so specifically, like, how do I distinguish between those? And if folks from the audience maybe have ideas, or, if you don't know, just ask. Ask any questions, by the way, as we're going through this. But what are some symptoms that I can like know for sure that I have a UTI, or when is the proper time to go to a doctor, kind of thing?
Okay, so symptoms of a UTI, also pretty easy to find on Google. So if you're ever not sure, something as simple as finding symptoms of a UTI or yeast infection, you can find on Google. Usually, Dr. Google's not your friend, but for something that's common and simple like this, yeah. Okay, so nice. The most common symptom for UTI would be burning while you're peeing. You also get increased urinary frequency, which just means like you have to pee all the time. And sometimes when you're peeing, only a few drops come out. You could have cloudy urine. So your urine's supposed to be clear, kind of like a pale yellow color. If it's cloudy, that could indicate a UTI. Lower abdominal pain, and then if you have fever or blood in your urine, that's kind of an indication of a more severe UTI that may have actually traveled up towards your kidneys. Okay. So you need to seek help ASAP, like go to the emergency room if you notice blood in your pee.
Okay.
And if you're pregnant, it's good to mention, if you're pregnant and you think you have a UTI, you should seek help right away as well. You don't have to go to the emergency room, but going to a walk-in or your general practitioner.
Okay, and that makes sense.
Okay,
and so that's just one question about blood. Is it going to look like bright red blood? Like, will I see it on the toilet paper, or like, what is that?
Yeah, pretty much. So bright red, it's gonna, in order, if it's that bad, it will show up in your pee like that. Bright red, either a little bit in the toilet. It could be. Sorry, it would be bright red on the tissue, but in the toilet, it could just be like a pale pink, because it's going to be diluted by the rest of the urine.
Okay, got you. Thank you.
Yeah. Okay, so yeast infections now. So they're most commonly caused by an organism that's actually supposed to be in your vagina and in your body in general, and it's called Candida albicans. It could be caused by other species of Candida, which is a yeast, but most of the time it is Candida albicans. So basically what happens with the yeast infection, something has happened that has changed the environment of your vagina, and it's caused overgrowth of that specific fungus, and that causes the symptoms, because you should have the right balance of these microorganisms in your vagina. So the balance is off, basically. So the symptoms would be a whitish, thick, cottage cheese-like discharge, or you could even have very thin and watery discharge. Also white, though. It's typically odorless, or just like a very, very slight yeasty smell, if you understand how to differentiate that. You could get redness, itchiness, burning, a little bit of pain externally on the vulva. And usually it will get worse 1 week prior to your period, because there's also a hormonal component in yeast infections. So what happens is the pH of of your vagina. It should be at a specific pH, but it gets a little too acidic. And about 75% of women actually get at least one infection in their lifetime. So it's pretty common. And then 40 to 50% of those women will get a recurrent. So it's quite common. Your risk will go up.
Okay,
yeah, sorry.
Just go back. Okay, that's a lot of women. Or that's a lot of people with vaginas getting these infections. So this is important, right? So also just a note on the pH balance. So you said usually the vagina is acidic, right?
It is usually acidic, but what happens is it gets a little too acidic.
Okay, cool. And that is from what?
So it could be from many factors. It could be from hygienic factors. It could be because from previous antibiotic use. So it doesn't necessarily mean that the change in pH has caused it. It's just is another sign that you have a little bit of a yeast infection. It could be because you could change the pH by doing things like douching and certain other hygienic practices.
Okay.
Or it could be the opposite, that something else has caused it, but the pH is changed anyway.
Okay, got you.
That
cool.
makes sense?
Thank you for that. Yeah.
Okay, yeah. Okay. And so your risk goes up for having a yeast infection if you are a diabetic, if you are on oral contraceptives, so birth control increases your risk of yeast infections. Pregnancy does if you are immunodeficient, which means that you have some sort of you either have something like HIV or you're on an immunosuppressant for an autoimmune disease. Or even with menopause. And again, like I mentioned, a huge cause is after taking an antibiotic for something else, say you had strep throat or something like that and you got antibiotics, it can cause a yeast infection. And that's because antibiotics typically wipe out all of the bacteria. It's not super selective. So they're kind of selective, but not very selective. So they just wipe out a lot of microorganisms and cause an imbalance.
Okay, wow. Okay, so there's a few things we have to look out for. And we're going to talk, if folks are wondering about like how to prevent that, because, sometimes there's like you have to take antibiotics and you have to take those medications, so, or, you have diabetes or whatever else. Yeah. And that's like totally fair. But we're going to talk about those in a little bit. And maybe let's just go over bacterial vaginosis really quickly, and then we can get further into the chat.
Yeah, so just really quickly, I want to go through BV and then a couple of STIs just so you know the difference. So if you have BV, it's actually, you'll get a gray, thin discharge with a fishy odor. You may or may not be irritated. Trichomoniasis is a common STI, and you'll get like a frothy yellow-green discharge and pain as well. Or commonly, two other common STIs would be gonorrhea, chlamydia. So you'll get all the symptoms of a urinary tract infection plus a fever, and then you could get either yellow discharge or you could get a little bit of white discharge, depending on which one it is. So, so just for more serious infections, the color of the discharge is likely to change. You'll probably get more and more serious symptoms.
Okay. Thank you so much for that. That's very useful. Useful tips. I'm going to have to like go back and look at all those signs and symptoms. It's important to know. And so,
for sure.
Yeah, I mean, following all that wisdom up, how would somebody, that doesn't have even access to Google or, they do, but like there's 100 other things that pop up on Medline when you type in symptoms, right? Like death, cancer. So how would like someone recognize those?
So I think the best answer for that is that you don't really need to recognize which specific one it is. It would be best if you would just recognize that something is wrong and then go seek professional help. Because a lot of the time we can't even really determine whether or not you actually have something without a culture or some kind of a test, a dipstick for, urine dipstick test or some kind of a culture vaginal swab.
Okay, got you. So you'd have to do some sort of basic test, like pee in a cup or get a pap test or something.
Pretty much a swab, yeah.
Yeah,
Exactly.
got it.
And then the doctor will diagnose you with that, and then with what you actually have, and then you can move forward with treatment.
Nice. That's good to know. So yeah, it's always nice to know a couple symptoms, say, okay, I think it might be this. Let's go to the walk-in or your doctor and or a naturopath. And so, okay, so I'm diagnosed with a UTI or I'm diagnosed with a yeast infection. So what should I expect when I go to my doctor's office?
So if you're going to your medical doctor, you'll expect to be given antibiotics or an antifungal. So for a UTI, you'll be given an antibiotic. For yeast infection, you'll be given an antifungal. So basically, yeah, that's kind of the only treatment. If we're talking about chronic yeast infections, some medical doctors will give you boric acid, which we'll talk about a little bit later as well. But it's just something to mention. Also for yeast infections, you can get over-the-counter Canesten, especially if you've had one before and you're like, I know this is a yeast infection. They do have that over-the-counter. That's kind of like a typical treatment, I would say.
Okay.
So for UTIs that have been complicated, like travel to your kidneys, like example, like you're seeing blood in your pee, you need the antibiotics. So go to the hospital, get that done. For something a little less severe, there are other treatments that we can do. And for yeast, especially when it becomes chronic. Yeah, and then for yeast infections, these can be fixed without the use of pharmaceutical antifungal agents. And in fact, like the long-term use of antibiotics and antifungals increase your risk of getting chronic UTIs and yeast infections. So it's kind of like this big perpetuating cycle. Yeah.
Okay. And so you mentioned the word chronic. For folks out there, how many days is that? Like, oh, I've been dealing with a UTI for 5 days. Is that too much? Like what before you have to do treatment?
So it's not necessarily about the days. Like it can be like 5 days is okay to have a yeast infection. It would be chronic if it's resistant to treatment. Like if we're doing treatment, you're taking those antifungals, whatever it may be, and it still won't go away. That would be chronic. Or if you've had, so for UTIs, it's if you've had 3 or more in a year, or for yeast infections, it's 4 or more in a year.
Okay.
That would be considered chronic. So 4 separate infections, even if they resolved after a few days, 3 separate infections for UTIs or 4 separate infections for yeast infections would be chronic. That means there's something else going on that's not allowing your body to fight off these infections, basically.
Yeah, got you. And is there any way to treat these at home, or should we just go to seek out pharmaceutical care?
I would go see a naturopathic doctor, obviously. So it doesn't have to be pharmaceuticals. I'm a little bit biased, but it doesn't have to be pharmaceuticals. Like I said, if it's very severe, especially with a UTI, go get your antibiotics. Please do that. But otherwise, there are other things that we can do to treat it, especially, so for UTIs, we can use antimicrobial herbs, which are nicer because they don't do, the ones that we use for UTIs specifically, they don't wipe out all the good bacteria too. And then on top of that, we'd likely give you a probiotic just in case, to make sure that those things everything's being replenished. Even if you do the antibiotics though, or antifungals, I think it would still be very beneficial to go see a naturopathic doctor who will be able to choose the right probiotic for you so that to prevent recurrence. And then for yeast infections, for the treatment, something antifungal, but we could do natural antifungal things. So something like tea tree oil soaked in a tampon. Never use tea tree oil alone. You have to dilute it in oil, by the way. You could even use, this is going to sound really silly, but you can take a garlic clove, cover it in cheesecloth, and stick it up your vagina and leave it in for a few hours. or or probiotics. So we either have suppositories, which means that they're like these almost, I want to call them capsules, and they're called ovules, that's what they're called. You put them up your vagina, or you can take them orally as well. But all of these things, like, seek guidance because it may not be right for you.
Yes, totally. Okay, that's really good to know. Also, you know, sometimes those things won't always work. So
yes, exactly.
Yeah, it's pretty important to seek out care first, and then go about it. Okay, and I'm anticipating some folks might ask some questions about probiotics in the future, just planting that little seed. But like I said, I know there's a couple of people that have entered since we've started, and if you do have questions or anything, just write it in the chat, in the comments section, and you'll see that on the menu side where it says chat there, and I can just mark it as a question as we are speaking. You can go ahead and ask any questions you like or any comments that you have. So recurrent, I think I kind of already asked you a little bit about these, but like, what, in terms of like not an active infection, but like a repeat infection, what's considered something that I really need to like go get help for on a deeper level? Like maybe my immune system is decreased or whatever, so that's why I keep getting UTIs and those things.
Yeah, exactly. So especially when it comes to yeast infections too, like, it could be a larger problem. You could have you could have some kind of disease or disorder that's causing your body to be immunodeficient, like we said with HIV, for example. So it's important to go get worked up if you are experiencing them chronically. If all those things are fine, then they're likely caused by something else, like we're going to talk about, like not poor diet, but dietary triggers, or again, frequent antibiotic use, poor hygiene, things like that. I did also want to note that chronic yeast infections can be a symptom of a larger systemic Candida overgrowth. So that's kind of, I'm seeing it more commonly now, we're seeing it more commonly now. So it's kind of a bunch of symptoms put together. You could have all of them, you could have just a couple of them. Really depends. So symptoms of a systemic Candida infection could be like fatigue, frequent nail infections, fungal nail infections as well. Allergies, like that chronic sinusitis, a lot of the time that's a low-grade fungal infection. That means, like, you know, the symptoms of allergies, you're always needing a tissue, things like that. Your sinuses are always blocked. Cravings for sugars and carbohydrates, which make things worse, but you're craving it. Difficulty concentrating, or just like having brain fog. Being irritable, again, vaginal infections and UTIs. Sorry, yeast infections, that's what I meant by vaginal infections and UTIs. And another huge one is digestive issues. So bloating, constipation, diarrhea, just like your digestive system is just a mess and you don't really know why.
Okay. Excuse me. Got you. So what I'm going to do now is get some audience participation. Let me just ask a question in the polls section. So that's the one below the chat option. And this is like maybe a little bit more personal, so that's why I'm making it a poll and not getting people to.
Yeah, the polls are totally confidential. I have no idea who's clicking what, so don't be afraid if that's what's holding you back.
Yeah. Let me just add one more option that I'm curious about. Okay. Okay, go for it, everyone. So the question is, who here has experienced chronic UTIs or chronic yeast infection?
Never. That's awesome.
Nice. All right. I mean,
I can't vote for some reason, but
oh yeah, because I made you an administrator.
Oh yeah. My vote is previously.
Yeah. I would also say previously. And that's just how it goes.
Okay. Awesome.
Cool. Good to know.
And like follow-up question, you can say something in the chat or not, it's okay. But has anyone ever been talked to about their microbiome?
By like a health professional, you mean?
Yes, by a health professional.
I would say yes.
Same. Myself.
And others.
Yes, for sure.
So what is the microbiome? Like, how important is the vaginal flora, and is that related to the gut microbiome, which a lot of other people are speaking about constantly?
Yes, constantly.
Yeah.
Tell us about that. Yeah, for sure. The answer is yes, 100%. So this is the key to prevention. Everything else that we'll talk about is important too, but what you really need to do is fix your microbiome, whether it be vaginal, gut, they're all connected anyway. Then that's what really needs to be fixed in order to prevent these things from happening.
Okay, cool. So they are related. Maybe just let's talk about what the microbiome is first, in case folks don't necessarily know. And because I know we talked a little bit about like pH balance and other things. So what actually is microbiome? And also maybe there's another word for it, like the gut flora, the vaginal flora. They're used interchangeably.
Yes, exactly. That is correct. It could be called a microbiome, could be called a flora. So the microbiome in general is really just all of the wonderful little bacteria, fungi, etc. that live in your body. So you've got them living in your gut, in your vagina, in your sinuses, on your skin, all over your body, and they're necessary for basically just keeping your body functioning well. So the gut microbiome specifically would just be referring to the microbiome in our gut. Literally, that's all that it is. And it has a huge influence on so many processes in our body. Like I could just do a whole other talk on just talking about the gut microbiome for sure.
Totally. And so vaginal flora is different in the way, and I'm just thinking of like, when you buy probiotics, there are different strains of probiotics for vaginal flora versus the gut, which is like the digestive tract.
Yes, exactly. Yeah. So basically, the balance of these the microbes basically are different in your gut versus on your skin versus in your vagina.
Okay.
Versus in your nose, like everywhere.
Yeah.
Yeah.
Got it. And do folks have any other questions about probiotics, or maybe we can chat a little bit more about them in terms of the effects, of taking a probiotic versus not?
Yeah, for sure. So again, so probiotics will be very helpful here in terms of preventing recurrence of UTIs and yeast infections, especially because we talked about antibiotics use being a cause for these things. So research shows that they positively affect the vaginal flora by promoting, what they do is basically they promote the growth of the beneficial microorganisms, and therefore that alters like the composition and then preventing vaginal infections that way. So basically you put in the right probiotics and that balance goes back to where it should be. That's all that happens. You're not killing anything. You're adding something to the environment to fix the balance, basically. So yeah, the right probiotics can suppress the overgrowth of Candida in the vagina, and we want to look for a lactobacillus species specifically. A lot of products out there, they will say specifically like a woman's probiotic, something like that, and that's usually when you know that it's indicated for yeast infections, UTIs, things like that. And the thing about probiotics, there's so many out there, and it's really hard to know which one is right for you. Like my best advice would be to seek help from a naturopathic doctor, because even for the same condition, there's could be 10 different types of probiotics you could be taking. And it does matter. Depending on what conditions you have, it does matter. The amount matters because they all vary in terms of how many organisms are in there, what strains are in there, things like that.
Got it. Yeah. And I know a lot of my friends are taking probiotics, and there's like not nearly, like, it's just taking nothing. It's just spending money on nothing. Like, there's the quality and quantity of probiotics, the strains are just not
not there. Yes, yeah. Exactly.
And so in terms of prevention, Dr. Alisa, changing gears here a little bit, is there other supplements? Like, I've heard of Mannose for urinary tract infections. Like, what's the efficacy on that? And is it useful, to just buy cranberry juice or something like that when you have urinary tract infections?
Yeah, so it's very common. I think that everyone knows that having cranberry juice when you have a UTI is a good idea. So it's for a couple of reasons, really. But there is a component in cranberry juice called D-men, and it's honestly a sugar, but it has been shown. There's good research behind it for being shown to stop the bacteria from multiplying, which means that it's not killing the bacteria, but it's stopping them from multiplying and proliferating. Because again, when it comes to an infection, you have to have a certain number of that bacteria for it to actually cause an infection. That's true of bacteria, viruses, everything like that. So you could have UTIs happen most commonly when E. coli gets into your urethra. But so E. coli is not supposed to be there, versus with a yeast infection, Candida is supposed to be there. It's just there's just too much of it. But if you have E. coli in your urethra, but it's not in a significant amount, you're not going to get a UTI.
Got it.
Again, so like I said, it stops the proliferation of them, which means that you're not going to actually get an active infection, which is great. So that's great for prevention, and also for an active UTI can be helpful. Also, the combination of cranberry extract with that D-Mannose has shown to be a good treatment as well. I talked about boric acid vaginal suppositories before. So these are actually prescribed frequently, probably even by your MD, for recurrent yeast infections and recurrent BV infections. Boric acid is basically a chemical acid, but it does work well. So we'll want to work on our microbiome as well as these things, but these are some things that can help to get to that, just in addition, basically. The other thing that's going to be important here are, like I talked about a little bit before, herbal antimicrobials. So especially if we're talking about a systemic Candida overgrowth, which is more common than you think, antimicrobials orally will be super important for that. So for the specifics, like, I really recommend you talk to an ND about this, but some examples could be like grapefruit seed extract, black walnuts, berberine, something called caprylic acid. A lot of the times they have like a combination products of these as well.
Okay, nice.
Yeah. And I also want to talk about vitamin D. Vitamin D is so important. Important for so many things. Even completely outside of vaginal health, vitamin D plays a role in your skin health, in your mood, in your immune health, which is what's important when it comes to yeast infections, UTIs, so many things. So get your vitamin D tested. It's not covered by OHIP, so you got to pay for it, but it's not that much. It's like $30-something, and it's really, really worth it. People in Canada do not get nearly enough vitamin D, typically because of the fact that we don't get enough sunlight, because that's how vitamin D is made, through the UV rays in our reaction with our skin, basically. Okay.
Got it.
Yeah. So again, like I said, vitamin D plays a vital role in your immune system. A low immune system equals increased infections.
Got it. So, Dr. Alisa, I know I'm conscious of time as well. I know you wanted to mention a little bit about, nutrition, and I think that's really key. So let's talk about a few things like nutrition that's really important for vaginal health. And then maybe I want to get into more of the
hygiene.
common practices of hygiene, because that's really, sweet.
Okay, so basically nutrition is super important. The ones that you really want to look out for are sugar, alcohol, wheat, the yeast containing things, and dairy. Usually wheat and yeast go hand in hand anyway. And they all can increase candida as well as decrease your immune system. So there is something called the Candida Diet. I don't really recommend that because it's so restrictive, but I still encourage to focus on lower levels of all of those, lower amounts of all of those foods. And then furthermore, talking about our microbiome, so eating in order to support our gut microbiome will be super important for keeping us healthy overall. So for eating for our gut microbiome means eating a lot of plant-based foods, good quality plant-based foods. So lots of vegetables, some fruit, especially like those berries and things like that. Lots of good fiber, oats, things like that. Basically, your gut microbiome needs these foods in order to proliferate in the way that it needs to proliferate, and then that affects the microbiome in the rest of your body.
Yeah, got you. I know there's like so much we could talk about in that regard. So basically what I'm getting is to just like lessen the amount of wheat and yeast
basically
in your diet,
and sugar and alcohol
and sugars, alcohol to sugar, you know,
yeah,
there's so much that contributes to that. And then outside of that, like even if you can't necessarily like eliminate those things, and by all means, I don't think like a full elimination is necessary, depending on what you're dealing with. But I think that even just adding more things into your diet, like more fiber,
exactly.
You can like buy fiber like supplements. You could just like add spinach to the smoothie. You know, you could add so many greens.
To your pasta, a handful of spinach in your pasta is a good idea.
Everything just cooks right in. You can hardly like you don't even notice it's there, and it right. So I always like to like add things in versus take away because it's
much out.
Yeah, because we're all about abundance here. You know, all about abundance.
Exactly, and you're totally right. Like as much as I'll say have those other things in moderation, that just means you have more room in your diet for all the wonderful things that nourish your body.
Yeah. Okay, nice. And I hope everyone listening is getting some good tips here and maybe jotting down any questions that you might have. We're coming up to question period, but first, probably the most important part of our chat tonight that I really wanted to get to was, is hygiene important and how do we wash our vaginas? How do we do it?
Great. Yeah. So of course, hygiene is super important. So when it comes to UTIs, women have much shorter urethras as compared to men. That's why you don't often see men with UTIs and non-chronic UTIs. So that means that there's more, an increased chance of infection. That's it. So really simple things like wiping from front to back. Is what you should be doing, or even air drying if you're comfortable with that. Avoiding soap. So a lot of people are not comfortable with this. Yeah. Avoid soap or vaginal washes, basically. Those are the things that can change the pH of your vagina, like
even if your region.
In your region, on your vulva. It doesn't, obviously you're not doing that in your vagina, but even on the vulva, it does have it will change, the pH in your vagina, which will then change the microbiome of your vagina as well. These things can be irritating to your vulva, to your urethra. You don't want that. So it could be causing some of these symptoms that you could think is a UTI or a yeast infection, but it's not. It's just using soap where you're not supposed to be using soap.
And like what if someone has like, scent-free soap, all that stuff? I know there's like such a thing as Gardasil.
Vagisil, you mean?
Vagisil,
yeah. No, this is the same thing. Vagisil is basically like, I hate Vagisil because they're basically, their entire product is making women's vaginal health worse. Actually, your vagina's not supposed to smell like flowers and fruits and whatever. It's supposed to just be what it is. And again, like I said, if it's smelling bad, then there's an issue, a medical issue that you need to go get checked out. Covering it up with Vagisil or whatever is not going to fix it. It's actually going to make it worse.
Got you.
And then one more thing that's really important, if you have a partner or having sex with someone who has a penis, it's really, and you're getting chronic yeast infections, you need to get your partner treated too. So the problem is, like, someone with a penis doesn't get the same symptoms as us, so they don't even know that the infection is there on them. But what they're doing is they're passing it back to you. And then, yeah, exactly. So that's why it's important to look at that as well in terms of hygiene.
Okay, really good to know. Anything else in terms of like hygiene specifically?
Yeah, just like peeing after sex is important. So there's conflicting research whether or not that's actually true, but it's usually recommended and there's no harm. So you don't have to get up like immediately afterwards, but with minutes, like a good medium would be like 10 minutes afterwards would be a good time to get up and go to try to pee. And yeah, just avoiding anything on your vagina, whether it be a soap, a lubricant, all of those things. Make sure, so again, avoiding soap in general, but sorry, when we're talking about lotions and lubricants, things like that, avoid anything that has glycerin in it, anything that has coconut oil in it, anything that is scented, anything that has petroleum jelly, anything that has added chemicals and colors like parabens, like make sure it's paraben free, and as well avoid oil-based lubricants because they can change the pH of your vagina.
Okay, so do you have one that's like good? Not to put you on the spot.
Yeah,
There's so many ones.
Yeah, for sure. There's so many ones. Off the top of my head, it's a German company, so I'm not totally sure how to pronounce it, but I think it's called Pure. And they have water-based and they have silicone-based, so that's kind of up to your preference, but they're very clean. And there's probably 5 ingredients in there.
Okay.
Yeah,
nice.
So it's really good. So it's spelled PJUR.
Got it.
But it's called Pure. And there's different ones, so you can always get guidance from the store.
Yeah, so as long as they're water-based or silicone-based.
Exactly.
And no parabens.
Exactly. And organic is best, limited ingredients is best again.
Yep, totally. And I do have a private question coming in. So what about types of pads and tampons? Is there anything that we should look for in terms of helping with the pH or helping with the hygiene?
Oh yeah, that's a great question actually. So in terms of pads and tampons, there's a lot of chemicals in them and some of them are scented too. And that's something that you want to avoid for sure because they can be irritating to the vagina and they could be, pads can dry out your vulva especially. And so that's a lot of people find pads irritating. So staying away from pads, staying away from tampons. If you want to use a pad or a tampon, it's best to use an organic cotton one, especially when it comes to tampons. Those are, or you could use the cup, like a Diva cup, for example, a menstrual cup. It is important that if you're having an active infection, like yeast infection, don't use your cup because basically you're going to be putting it right back in there.
Right. Yeah. And I actually just got a pair of these. They're called Thinx, THINX.
Oh, yeah.
They're period panties. So I just wear them and they act like a pad and they're reusable and you just wash them in the sink afterwards. And it's great.
Yeah, exactly. And so those are the best, those synthetic, a lot of pads and tampons, they actually have plastic over them. You don't want to be putting that on your vagina at all.
Okay. Got it. Nice. Someone also has things. I love them so much. They're so good. Okay. Let me just ask, because I know people are probably thinking it and maybe don't want to ask. So let me be that person. What are vaginas supposed to smell like? And are they, is it normal? I don't know. Besides fishy, there's other smells that sometimes happen and you're like, what is happening?
Yeah, exactly. So again, like with those hormonal changes, sometimes the smell can change too. You can get some discharge is normal throughout your cycle, especially when, your discharge will change. Sometimes you'll have a little bit of white discharge, and that's normal. Sometimes you'll have like a clear, sticky discharge. That means you're ovulating. In terms of the smell, it depends on what you're smelling. If it has just like a faint odor of just vagina, like it's hard, it's really hard to describe, but just a very faint odor, that's totally fine. It's more odorous around your period because of all the blood and everything coming out, and that's totally normal. But again, looking out for that fishy smell or really, really strong smells that have nothing to do with your period, that's when you know something's wrong. But otherwise, like, vaginas are just what they are.
Got it. Useful.
Yeah.
So, are there any other products or maybe this is a good chance to ask the audience now, and there is an option to ask just us, so it doesn't come up in it comes up more anonymously, so I can ask it if someone has a question about something like in particular, what's happening with my vagina, what's a symptom of this, blah, blah, blah. Also, I do have another question, but I'll hold my tongue for a second in case other people have some questions. I love this. I'm like so inspired and pumped. And maybe before we go into question period, I can ask you my final question, which is, actually, I lied. 2 final questions, and I'll one because I'm saving any questions. But my kind of scripted question that I always ask folks is, what keeps you inspired, Dr. Alisa?
Yeah, that's, it's a difficult question, but
is it?
Yeah, it is, honestly. But I'd have to say that I'm inspired by people like women like you, honestly, who just go out there every day and kick butt and do their thing and are doing amazing things for themselves and just making a way for themselves in the world. That's what inspires me to do good.
Oh, that's sweet. And it's people like you that inspire me, which is amazing.
Look at that.
Just inspiring each other. And the folks who are tuning in tonight, I love that too. If we can do anything to make healthcare more accessible, that is my goal, and to really reframe what the system that we've inherited right now. It is not one that helps us very much. And don't get me wrong, I love the fact that we have paramedics and ER and everything and life-saving medications. And that's not what I'm saying here. It's that I think we're just shifting in terms of society from, more of a reactionary type of medicine to preventative. And it's really important that we do everything in our power and feel empowered to feel more responsible to get help and to seek out care and to do the little things that make maybe not a huge difference, in one day, but to do little things over a bigger period of time every single day so that we can reap the benefits when we're, older in age or whenever.
Exactly. And that is exactly why I do what I do.
Amazing. Okay. I didn't see any questions coming in yet, but I will ask one question that you kind of already touched on, but I want to get into it more.
Sure.
What are your thoughts on douching? Why is it even a thing, for one? And what are your thoughts?
Honestly, douching is just like this old, almost thing that was passed down from your mother and your mother's mother and all the whatever. I feel like most people,
guy who made it up.
Yeah, right. I feel like most people at this point don't douche. I think they know at this point not to do it, but that's usually when you use vinegar or lemon or something like that in water and you literally spray it up your vagina to clean it out, and don't do it. Just, it's the same. Imagine just using a soap on the outside on your vulva changes the pH. Imagine actually putting something in there. And like I said, vinegar is acidic, right? So that's going to make your vagina even more acidic, which is going to cause the yeast infection. So don't do it. Your vagina is wonderful. It's self-cleaning. It does not need to be cleaned on the inside. And again, you'll be disrupting that microbiome, the pH, all that stuff. So don't do it.
Got it. Got you. I appreciate that. And that clears up some things. And then even just in terms of like a moisturizer, you know, some people like to shave, some people don't, but how kind of friendly are moisturizers in and around your vulva area? Or like maybe I should steer clear of that. You know, what is your thoughts on that?
So you should moisturize your vulva. That is one thing that you should do. So washing with water and moisturizing with either like a very natural oil, but not coconut oil, because coconut oil has antimicrobial properties, which can disrupt the microbiome. So something like an almond oil, a vitamin E oil, even those are pretty, they won't really do anything. Again, not putting them inside, but just on the outside of your outer labia. You could even do something like a shea butter, just plain shea butter, or just a plain cocoa butter, something like that. Natural is better, organic is better, unscented, paraben free, all of those things are important.
Okay, good to know. And thank you so much for, you know, I know we're like a couple minutes over time, and no worries. Thank you folks for listening in and staying here. I did want to also mention before we go that, you know, any last words from anyone, please write it in the comments now. I want to actually just insert a file here, and that is Dr. Alisa's, is it 5 hygiene or just hygiene?
It's 5. It's not all hygiene, but it's 5.
Okay.
Yeah.
I'll just call it
5
vaginal
ways to keep your vagina healthy, basically.
Amazing. So let me just upload that real quick for folks that have tuned in, and that can be a little freebie that is useful for folks. And if you want to share with anybody who couldn't make it tonight or whatever, it's just down there in the files section. Amazing. Can everybody see that? Can you see it, Dr. Lisa? Yeah. Okay.
Yeah, I can see it.
Yeah, I shared it. Yeah. Okay, perfect. So
you'll also be getting it in their emails, right?
Yeah. Yeah. So I'll add that to the email, and for anybody who didn't get a chance to watch today but did register, you'll automatically get sent something from this platform called Webinar Jam into your email tomorrow in about 24 hours. And I'm going to put it on my YouTube channel as well. So take a look there, and I'll email it all out to you and include the file, because healthy vaginas. Yay.
Yay. Yeah, feel free to share that with anyone, honestly. Yeah, thanks everyone for listening, staying the whole time. That was awesome. I hope you enjoyed it.
Someone says it's really important for us to be more comfortable to talk about our vaginal health. And
yep. I agree. Thank you so much. Thank you.
Thank you, Dr. Alisa, for coming on and sharing your wisdom with us. Thank you, audience, for being here. And Dr. Alisa Murli, everyone, how can they get in touch with you?
Instagram, Facebook, email, or through my website. So again, that will be, my contact information is all in the handout. And honestly, it's very easy to find me, Dr. Alisa Murli. That's all my handles. So
great.
Yeah,
I love it. And Inspiring Insights happens every week, every Wednesday. We're changing the time from 6 to 7 now, so as to suit a few more of your you folks in the evening time, trying to get dinner ready and all that. 7 p.m. Tune in here live with us, and if not, sign up for my email list, and you'll always get the replays there. Okay. Thanks again, everyone, and wishing you all the best for the evening.
Yes, thank you. And thank you, Air. Again, you're a wonderful host.